And now, to start our day, I would like to invite on stage Dr. Beáta Sperlágh, who is the director of the Institute of Experimental Medicine of the Hungarian Research Network. Beáta, the floor is yours.
Okay, good morning, everybody. And my task is here to give a short recap and summary of the yesterday sessions. And I think that several sessions, discussions, lectures yesterday were very inspiring and enlightening for every one of us. And I have just collected some important thoughts that I recorded during the sessions from the speakers. Even a few of them were repetitively emerging, such as the symbol of Rubik's Cube, which is not only the symbol of the Hungarian European presidency period, but also the symbol of creativity, mindful thinking, and and the symbol is how we try to approach this multi-stakeholder approach of holistic brain health. So the first part of the yesterday program was a presentation of László Bódis, Deputy State Secretary of the Hungarian Ministry of Culture and Innovation, who provided a summary on the innovation landscape of Hungary, highlighting our 12 Nobel laureates and some increasing scores in the innovation activity of the countries, such as increase in funding, research personnel, and 50% increase in PhD students since 2010. He also expressed that there are 5 key pillars of the ministry's activity to further promote innovation by the tools of tax breaks, national RID funds, a novel corporate policy, and connection of universities with industry, and important focus to certain areas within the large world of innovation. He also mentions that there is a challenge of competitiveness in innovation, not only in Hungary, but in the whole countries, resulting in a lower productivity benchmarks, for instance, in the publication records, and some special problems of Hungarian innovation, such as the low supply of researchers, entrepreneurs, low TT activity, and low level of innovation at small enterprises, the low number of startups and venture capitals, which is characteristic not only for Hungary, but also for the Eastern European countries. And the vision of the ministry is to be among the EU's top 10 innovators by 2030. And there are 5 focus areas: digital transformation, health, green transition, security, and safety. And there are many tools whereby they want to achieve these goals, such as more TTC activity, science parks, and university venture capital. So then this was followed by the video message of Irena Nostad, the Director of People from the DG Research and Innovation of the European Commission, who delivered several messages highlighting the importance of mental health, especially those of the mental health of the children, which is an increasing burden in Europe. And of course, the topic of the conference, why we are here, brain diseases, brain capital, and brain technologies. Of course, she has also called attention to bridge the gap between the research, clinical work, and innovation, and introduce the initiative of a comprehensive approach to brain health partnership from 2026, and to make hubs more push into clinical research, data sharing frameworks, and mentioned several areas of brain disorders such as neurodegenerative diseases or neurodevelopmental disorders, which really represent huge burden for the EU. And the goal of the conference is to somehow put together the knowledge on this area by the many different kind of stakeholders. So then this was followed by the first panel discussion by four outstanding participants from different countries and different areas, such as clinical psychiatry, neurology, patient organization, and others. And the goal of this discussion was to somehow solve this very difficult question, that how to overcome the existing fragmentation between different areas, different stakeholders. And different speakers emphasize distinct aspects of the approach to this problem. Of course, the EU context has an added value by making possibilities for multi-center studies and make a stage for the collaboration from different countries and areas. However, it is also important to recognize that Europe is a very special part of the world, as mentioned by Professor Parellada. So the regions are too small, and the expertise needs to complement, and also it's necessary to involve the social and environmental sciences to this effort. Tünde Koldai, the leader of the patient organizations in Hungary, called the attention to the differences in different healthcare systems in Europe and the implementation of good practice, whereas Professor Arnesen called the attention to the Rubik's Cube, that we do not see at one time all sides of the square, and we have to do these activities better. So next, how can we bring the actors closer together? The discussion raised other important thoughts, and everyone tried to articulate the elements of activities whereby we can bring the actors closer together, such as with well-functioning national institutions, healthcare, learned societies, and funding, and also including not only those who are involved in any level of brain research, but also the area of social sciences and even the philosophical perspective. And there are also some problems and burning questions came up, such as the huge knowledge gap between the different actors of brain health. Actors, including basic scientists, clinicians, and patients, and also brain health organizations. So it is necessary to talk with each other on the same language, and also important to identify who is who in this big network of different actors. Then during the next panel session, the question was put forward that why global cooperation is necessary, and the participants of this panel session provided different answers, and these interesting and important answers to these questions. There are many arguments, such as the huge gap between the expectation of the society and the current state of the treatment of brain disorders. And a lot of money has been put into the research without enough breakthrough results. And it's also important to promote diversity in the research. That is why the global dimension is important on genetic aspect, ethnicity, but also geographically. We are only Europe, but brain health has a huge impact also other parts of the world. So Professor Menon is a well-known expert in traumatic brain injury who has initiated an international collaboration partnership on this area as a good example, a good practice on this global cooperation area. And other panelists also raised other examples, such as the success story of cancer, and also the necessity to build up a large partnership outside Europe, and again thinking out of the box, and not only thinking on brain, but regard brain as a part of the whole organism. For example, thinking on the gut-brain axis, and which also have a big influence on brain functions, or thinking in a brain-body unity. So there were also fruitful discussion on different data management issues, which is a striking problem of any kind of collaborative research, big research, big ventures to make a partnership between different stakeholders. And well, it is important, and we are in the age of the big data research, but also a very important aspect of the protection of the data and the control about the data. And here, in addition to discussion, important opinion came also from the audience, such as Dr. Dinyes raised the subject of diseasomes and the problem with the quality of the data, not only which is generated by the research, but which is sent to publication, as more than 1,000 papers were retracted from Nature, and there is a noise in the system, a pollution in the editorial work. And there were suggestions how to collect more effectively data in a reliable way, such as the online collection of data on cognitive function. And finally, the possibility of stigmatization of patients was also raised by the representative of patient organizations, indicating that in case of mental disorders, the quality of data could be also impacted by the different attitude of the patients to the research, and that's why this could introduce an error in when these data are handled and conclusions are drawn. And finally, we concluded that the normalization of the idea that even the scientists could have mental disorder is very important. So the future is to obtain more global, good quality data and understanding different layers of the Rubik's Cube. So then there was an important session held by Tünde Koltai, just raising the voice of the patients, an important stakeholder of this whole network, and just providing a presentation of different aspects important for the patient organization, the community, which is, I think, the final target of all of our approach, including quality of life and the social determinants of health and the needs of the patients. So then, in the afternoon, we had a parallel session. I cannot be present in 3 different places, so I have joined to the first parallel session where 4 excellent young neuroscientists presented their study and their special aspect to brain health research and about future perspectives. And also they shared on their vision on future success and obstacles which hinders their work to achieve this success. This include some novel technologies, novel approaches in brain health sciences, such as theranostic interventions or neurotechnology, which is an emerging new line of research to influence brain function, and the future, maybe in the future, the brain-computer interfaces could treat even paraplegia or vision. And of course, there are many obstacles, including lack of funding and other problems which have been already mentioned by other sessions, such as the assessment of the sciences. There are also problems were recognized. And finally, the day was closed with 4 interacting sessions. And I have chosen the 4th, which resulted in very interesting discussion consisting of 3 excellent panelists Thilo von Eimeren raised issues. So the goal here was to discuss what are the gaps in brain health research and how to address them. And trying to solve these issues, we got 3 excellent short presentations highlighting everyone's each approach and aspects. And whereas Thilo von Eimeren highlighted the problem of data sharing, adherence in biomarker, imaging biomarker studies, and quality standards of AI, whereas Professor Markund showed an interesting new area of research on concussion injuries of athletes, whereas Francesca Cerulli highlighted that the brain health starts in the womb and highlighted the importance of environmental factors such as metabolic stress as a risk factor for the mental disorders. And again, it was mentioned that the huge amount of time which is lost with the unsuccessful grant application activities is also loss of money. So I think that maybe here my time is coming to over, and just for the setting scene for the day 2, we are facing very interesting and important session during the second day as well. Maybe an attempt could be made to putting the pieces of the puzzle together, or to somehow solve the Rubik's Cube's side to one color, one side. And I wish you success for these activities. There will be very interesting and different activities today, morning and afternoon. It is in the program, so I think I don't detail it further now. And the day will be closed by a final closing session. So thank you very much for your attention.